Hi everyone, welcome back to my channel and welcome to all new viewers. My name is Olka and I'm a UK-based vet, and today I'd like to talk to you about common cat poisons. Before I get to it, please don't forget to like, subscribe and ring that bell if you enjoy my content. This allows me to keep this channel going. I aim to release a video every week. I also have an Instagram account where I post daily, so go and check it out. Without further delay, let's dive into the topic of this video then. Intoxications and poisonings are one of the many reasons your cat might get poorly and require veterinary attention. They can be exposed to dangerous substances without us even knowing or realizing it. Maybe you don't expect your cat to encounter a certain toxin around your household or neighborhood, or maybe you simply didn't know it is harmful to them. Exposure to certain substances can have terrible consequences, often fatal. I think it is important to educate yourself as much as possible on what is poisonous to the species of animal you own. Maybe your cat suddenly took ill and you are not sure why. When you talk to your vet, try and remember what your cat might have eaten or ingested other than its normal food, as it might be the source of the problem. In the vast majority of cases, prompt treatment in cases of poisonings is absolutely essential, and chances of recovery and improvement increase massively if your cat is taken to a vet straight away. Never wait for your cat to develop symptoms. Grab your cat and rush to your vets. The toxin number one on our list are lilies. Lilies are nephrotoxic to cats. Nephrotoxic simply means damaging to kidneys. Ingestion of even small amounts of any parts of the plant can cause a potentially fatal acute renal tubular necrosis, which is a serious type of kidney damage. But luckily, the damage can be controlled if treated early. Immediate treatment is key. Early signs of this poisoning include vomiting and dullness. Within 12 hours, more specific changes occur. Signs of acute kidney injury, dehydration, lack of appetite, depression and more vomiting. Some rare symptoms seen in severe cases may include disorientation, lack of coordination, swellings of the face and paws, head pressing and seizures. Within 24 hours, changes are detectable in the urine sample. Severe cases may become anuric, which means the cat's urine output stops. This unfortunately indicates a poor prognosis. Treatment, depending on the case, may include decontamination and fluid therapy for the first 48 hours, even if clinical symptoms are not yet present. Delaying treatment may allow irreversible damage to happen. Decontamination methods could include simple methods like washing pollen off the cat's coat, and some that usually require your vet's attention, like inducing vomiting if the cat has been presented within a few hours of ingestion of the toxin, and administering activated charcoal to help reduce absorption of the toxin within the gastrointestinal tract. Early and aggressive treatment is typically successful if started within the first 18 hours. My general advice would be to never allow lilies in your house if you've got cats. The same applies to your garden. Not worth the risk. Next on the list is Permethrin. Permethrin is a medication and an insecticide. Products containing it are available as over-the-counter flea treatments for dogs, and it can sometimes be found in insecticide sprays used to treat the house. Permethrin is highly neurotoxic to cats, or, in other words, negatively affecting the nervous system. Intoxication is common following accidental use of an inappropriate flea treatment, or via close contact between a cat and dog that has recently had a permethrin-containing product applied on it. Immediate treatment is important. Symptoms can develop within hours of contact, but may be delayed for up to 2 days. Commonly observed signs can include excessive sensitivity to touch, tremors, muscle twitching, seizures, and increased heart rate. Less commonly reported problems include dilation of the pupils and difficulties breathing. Treatment-wise, the most important aspects are to control seizures and to prevent further absorption of permethrin. So decontamination is the simplest and most important thing to do first. This can include shaving off the affected fur and washing the area with lukewarm water. In the majority of cases, the prognosis is good, as long as the problem is recognized promptly and treated aggressively. Seizures and body tremors typically subside within 48 to 72 hours, but minor residual tremors and twitching can last for up to a week. Always read the leaflet of the anti-flea product you are about to use, and definitely never use a product meant for dogs on your cat. What's next? Let's talk about ethylene glycol, otherwise known as antifreeze. Antifreeze is a liquid that is added to the water in your car's cooling system. Ingestion of antifreeze can lead to metabolic acidosis, kidney damage, and formation of crystals in your cat's urinary tract. Metabolic acidosis is a serious electrolyte disorder characterized by an imbalance in the body's acid-base balance. Ingestion of even small amounts, such as from grooming a contaminated coat, can result in serious problems. As an interesting fact, some animals may choose to ingest it, as it is sweet in flavor. Signs of toxicity may include vomiting and dull demeanor. Within 1 hour, symptoms could progress to lack of coordination, increased respiratory rates and increased heart rate, excessive urination and thirst. Within the next 12 to 24 hours, metabolic acidosis develops, and signs may include dehydration, vomiting, and blood in urine. Within 1 to 3 days, acute kidney injury is developed. Further signs may include continuous vomiting, lack of appetite, depression, low body temperature, and eventually coma. The severity of signs depends on the amount ingested. Absorption of ethylene glycol and metabolism to its toxic byproducts is very quick. Immediate treatment is necessary to try to prevent fatal acute kidney injury. Treatment may include ways to prevent further absorption of the toxin, like inducing vomiting and administering activated charcoal, but in many cases, if an affected cat isn't presented immediately, this will no longer be helpful. Aggressive use of IV fluids will help to counter kidney injury and metabolic acidosis. An antidote exists, but it needs to be given within 3 hours of ingestion of the toxin to be effective. It's not usually stocked in most veterinary practices, at least from my experience. Another available substance to aid the treatment could be ethanol, which is our common alcohol that we humans consume. It needs to be given intravenously, so do not attempt to treat your cat yourself at home. The way it can be helpful is by diverting a special enzyme from metabolizing ethylene glycol, antifreeze, to its toxic byproducts. However, its use comes with its own potential side effects. The damage caused by ethylene glycol depends on the amount consumed, but the prognosis unfortunately is guarded at best. Onset of irreversible kidney damage is quick. If therapy is not started within 3 hours of ingestion, the cat is unlikely to survive. Always make sure your cat doesn't have access to your garage, where you might store products like these. Do you live near a garage or a car mechanic? Probably better then to keep your cat indoors. Next on our list are so-called non-steroidal anti-inflammatory drugs. This vague name of a group of meds apply to meds often used to treat various types of pain and inflammation. Cats are susceptible to side effects from overdosing or inappropriate use of these types of medications. The main adverse effects are ulcerations within the stomach and kidney problems. Lots of cat owners don't realize the potential risk these drugs can cause if not used properly. Using medications given as leftovers from your neighbor or a friend without consulting your vet is not a good idea. And this happens fairly often, I have to say. Always follow the recommended dose to the dot. Oral preparations of this medication have to be given with food. Clinical signs of gastric ulceration include lack of appetite, depression, abdominal pain and vomiting. Sometimes you would see blood in the vomit too. If presented early after overdose, Initial treatment usually consists of induction of vomiting and administration of activated charcoal to reduce absorption of the substance as much as possible. Thereafter, treatment with antacids and other medications might be needed. Symptoms related to kidney problems depend on whether we are dealing with an acute kidney injury or chronic kidney disease. Now let's talk about the use of human medications. Many owners are tempted to treat their pet themselves without realizing lots of medications harmless to people can be really dangerous to pets. One of the main ones here would be paracetamol. Cats cannot metabolize paracetamol easily. Toxicity could result from a single dose. Symptoms may include weakness, dullness, lack of appetite, excessive drooling, vomiting, swelling of the face, and increased respiratory and heart rate. Abnormal color of mucous membranes can develop. Blood of affected cats can have a characteristic brown color due to methemoglobinemia. Methemoglobinemia is a disorder in which the hemoglobin molecule is altered and prevented from carrying oxygen. Within 12 to 24 hours, hemolytic anemia can develop. Hemolytic anemia, to put it simply, is a disorder in which red blood cells are destroyed faster than they can be made. Liver failure may develop within days. Treatment, as usually with poisonings, includes decontamination by inducing vomiting and administering activated charcoal if an affected cat is presented early. There are also a few other medications which can be helpful in treating paracetamol toxicity. The damage caused by paracetamol is dose-dependent, but the prognosis is guarded in all cases. Never use medications meant for humans without consulting your vet. This might end up having fatal consequences. Seemingly harmless onions and garlic are toxic to cats. Ingestion of these may cause methemoglobinemia and hemolytic anemia, similar to effects found in paracetamol poisoning. Owners often forget onions and garlic can be found in many processed foods which they might be tempted to feed to their cat. I always tend to advise against feeding your cats processed human food products like sausages, ready-to-eat meat products, or baby food. If you do not read labels carefully, you never know what is in them. Last on our list are rodenticides. Rodenticides are pesticides that kill rodents, like rats or mice. These are commonly used in and around households, gardens, farms, and even urban areas. Cats could ingest bait that has been left down for rodents, but typically toxicity will arise due to the cat hunting down and eating a poisoned prey. The commonly used rodenticides cause fatal coagulopathies through vitamin K deficiency. Coagulopathy is a condition in which the blood's ability to clot is impaired. Affected cats present with lethargy, lack of appetite, hematomas, pale mucous membranes, difficulties breathing, and collapse. Other reported signs may include bleeding from ears, blood in poop, and red marks on the cat's skin. Treatment, again, as usual, include decontamination, so inducing vomiting and administration of activated charcoal if presented early. Coagulopathies should be treated with daily vitamin K. This might need to be given even up to several weeks. In severe cases, a blood transfusion may be needed. So there you go. If you want to avoid these terrible situations, inspect your house, inspect your neighborhood if your cat goes outside, and try to eliminate those from your pet's environment. But also remember, if your cat happens to ingest any of the substances I mentioned above, seek help from your vet. It can often save your cat's life. I hope I helped you understand some common feline poisonings better today. And lastly, thank you for watching. I hope you like my video, like, subscribe, and I hope I'll see you here again soon. Bye!